episode of Africa Health Check.
We get to wonder what's going to happen to our children. There's no vaccines, there's no immunization.
We Africans, especially we Nigerians, we have strong immune. We are coping more than every other persons.
We delve into the critical topic of maternal and child health care in our African continent. Many countries in Africa continue to record high rates of maternal, infant, and child mortality due to preventable causes. On today's episode, we will be discussing maternal and child health. We aim to explore the current barriers to care, highlighting why maternal and child mortality remains a persistent challenge in sub-Saharan Africa, and the need for innovative solutions that address these barriers and promote access to quality health care for women and children. I am your host, Morokozo, and I welcome you to Africa Health Check. I'm joined by our experts, Dr. Marianne Moreithi, the chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. Before we hear from our panelists, let us have a look at this episode's feature story.
I am Edmond Diodu Echeri from Tichamanti in the eastern region of Ghana. I'm a public health nurse by profession and also the executive director of Divine Mother and Child Foundation, a non-governmental organization based in Koforidua, eastern region of Ghana. So what we do is to make sure that we provide free ultrasound scan services for pregnant women and also provide hemoglobin checkups for pregnant women in the rural communities. So basically, we ensure that we reduce maternal mortality through these services that we do or we organize in the rural communities. We provide these services in collaboration with the Ghana Health Service. And so what we do is to map out communities which are hard to reach, including island communities. And so in collaboration with the Ghana Health Service, we are able to identify these communities. And then we liaise with them, provide transportation to enter these communities to be able to get these pregnant women. And also sometimes community members themselves do reach out to us. Nurses, midwives, and other health staff who are in the hard to reach communities also do reach out to us to go to these communities or come to their communities to provide these services for them. So as a young nurse, I decided to have an initiative or an innovative way to make sure that we bring these services to the doorsteps of these pregnant women. And so after my national service, I decided to set up this NGO to ensure that we go to the rural communities and then we provide these services. What motivated me was that, in fact, I was born by a TBA. I was also born in a village, and as a result, I saw so many pregnant women dying during their deliveries. So I had a passion to make sure that we promote maternal and child health. My grandmom also died when she was delivering her last baby, which is my mom's sister or my cousin, my auntie. And so it's something that has been bothering me for a long time to see pregnant women dying as a result of giving birth. So this motivated me to make sure that what happened during my era should never happen to any pregnant woman. We want to see all pregnant women having access to basic services like ultrasound scan services in their own communities, where CHIPS compounds have this basic equipment to support our pregnant women. We want to see Ghana become a champion in terms of maternal and child health. We want to see a future where a pregnant woman will never die during delivery. And this is what we want to do. So we are open for partnership and collaboration. We believe that as a country, or as people, we need to invest more. We need to make sure that women are empowered, and that is one thing. And I think that when women are empowered, we will be able to address all these barriers in terms of maternal and child health. I am also advocating, and I'm also encouraging all pregnant women to make sure that whenever they see that they are pregnant, they should visit the health facility regularly. The midwives are ready to support them. We are also ready to help them.
And that has laid the perfect foundation for our conversation today, where we are talking about maternal and child care. And I want to start with you, Dr. Marianne. You know, there used to be this saying a couple of years ago that when a woman is pregnant in Africa, she has one foot on earth and another foot inside a coffin. And unfortunately, that remains true. So why is it that to this day, child and maternal mortality remains a persistent challenge in sub-Saharan Africa?
And that's really sad, actually, Gigi, to have such a saying. And it's the most beautiful time in a woman's life. But to have her life hang between here and there is not very good for this woman and also for the community. So your question is, what are the barriers? And for me, I see the barriers in many ways. There are interpersonal barriers, there are cultural barriers, and many other barriers. For example, personal barriers, poverty. You may lack the financial muscle to be able to seek maybe a good intervention, seek to go to antenatal clinic, and that way they could have spotted a problem way beforehand. The other issue in interpersonal could be also lack of knowledge, illiteracy, you know? Again, this woman is not well educated or well versed to knowing how to look after herself. 3, could also be infrastructural barriers. The clinic, the hospital is far, far away. And maybe it's because of the system, the remoteness of where she is. She's in a remote area, and for her to access the antenatal clinic, it's very far. So she just soldiers on until she feels the labor pains, and that time maybe there were complications that could have been avoided. Other barriers that could be also cultural barriers. Remember, in Africa, it's very, can I say, patriarchal. A man has to make the decision.
Even about a woman's
Even about her health, even about her delivery, even about her pregnancy.
her body.
Yes. So maybe she has to seek permission. Or maybe she has to continue doing what she's doing, go to the farm, go to continue the business. Maybe she has many other children she's looking after. So there's very many barriers. And we need now to sit down the way we are on a table, all of us, and start saying, how do you break those barriers? And I'm hoping we can touch on that later on.
Absolutely. I don't know, Reverend, if you want to add on to some of the other barriers to overcoming the challenge of child and maternal mortality in sub-Saharan Africa.
Yeah, it's not only in maternal mortality and child mortality that we're talking about, but also in other areas of health. Most Africans, I would say some Africans, respond to or seek health care symptomatically. If I feel something, then I need a doctor. If I don't feel anything, why do I have to go to the hospital? So a woman becomes pregnant, and for 2 months, 3 months, she doesn't feel anything. She doesn't see the need why she should go to a clinic, be in a queue, go and see the doctor about what. So they keep these things until it is too late. But if they had, had periodic visits for checkups, like this gentleman is using ultrasound to check whether the baby, how movement and all other things, I think certain problems wouldn't mature and gravitate into the unfortunate stories.
And maybe perhaps that is because of the socioeconomic factors that Dr. Marianne was talking about earlier on. And the thing is, if we know all of the barriers that you're talking about, access, affordability, transportation, all of these barriers, why are we still failing to mitigate them to ensure that women and children have access to quality health care?
I feel Actually, there are some successes. Let's not just highlight the failures. There's been a huge improvement on maternal outcomes within our communities, and we are seeing children thriving and mothers thriving, but I feel we can do more. And some of those barriers, again, in my opinion, could be also the lack of implementation of the universal health coverage, where there's equitable access to all these health systems, that this woman can walk to the dispensary and see a healthcare provider who will look after her maternal outcomes as well. So can we strengthen that? And I mentioned, I would like to introduce what we have here in Kenya, what you're calling Linda Mama, or Protect the Mother. And this has been rolled out in the entire country, in each and every hospital, in that she doesn't need to have money to get or access good maternal care. That will be provided because the government has given money to make sure there's a gynecologist, there's a trained nurse, trained community workers within that setup. But I still feel we can do more.
Absolutely, absolutely. And I want to ask you, Reverend, as a community leader, and as well as a public health practitioner, would you say women and children are high on the political agenda in Africa? Are they a priority?
Yes and no. Yes, because we are not doing so much. Ghana has a record. There was a time, I think before 2013, that maternal death, child death was so high. Before they introduced the NHIS, that is National Health Insurance System, where they made it free for all pregnant women to access health everything free. And when they did that, it reduced the mortality so drastically. So that is what I mean by yes, but no. No, because they are not doing so much. I think they should increase support, increase these things to help.
I loved your question about women and children. I was just laughing and I was waiting to hear how he answers that, because I feel sometimes as a woman, I feel we get used for that political vote, because we'll be the loudest, we'll do our dances.
We are also the majority as well, so they need that token. Yes, they forget. Yeah, because also ultimately, Reverend and Dr. Mary, and I once went to a public health seminar, and the facilitator said, don't tell me what you prioritize. Show me your budget and I'll tell you what you prioritize. Oh, yes. So if at all women and children are a priority, let the budget say that. Let it show the investments that go into maternal health, child health, infant health, and all of those things. Very interestingly, there's this thing in my country, in Botswana, that I've always talked about and just always amazes or shocks me, for lack of a better word to use. So the Ministry of Agriculture, they have their officers who actually do outreaches to the farms, to the rural, remote areas, and they make sure they go there to feed the cows, the cattle, the bowlers. And I'm like, why is it that in the health sector, we don't have such outreaches to go and ensure that children get their monthly immunization, because this is something important. And some of them, when children are dying under 5 due to preventable causes, usually they're not immunized, they don't go to the clinic for regular checkups, it's usually malnutrition and all of those things. So is that really showing that women and children are high on the political agenda in Africa?
The priorities, we need to switch these priorities, and really concentrate on this vulnerable or key population, as we call it in our healthcare setup. They are key, because without a woman, the community will not thrive. Yeah, and without a child, where is that joy that comes in? So we really need to protect them.
Yes, absolutely. When we come back from the break, I want us to look at innovative solutions that could be recommendations or that we know are being implemented in other parts of the world that could help with producing better maternal and child health outcomes. But for now, we are going for a quick break where we'll hear what the people on the streets of Africa had to say. Stay tuned.
Hatua nazochukua ili kudumisha mtindo wa afya hapa jijini Dar es Salaam huwa ni usafi. Kingine ni katika kuzingatia matumizi yangu ya bima vizuri, maana mara mwingine bima zinaenda bila kutumika vizuri.
When the government takes care of the youth, or when the government shows example of sincerity, the youth will embrace them naturally. But this government is always giving the youth, making them to be afraid. And that is why the youth is afraid of involving in helping in that sector.
Personally, it has affected me a lot because of COVID-19, I lost my job. And the measure that I'm taking is to learn skills. So I'm learning, and I think that one will help.
Welcome back to Africa Health Check. Today we are talking about maternal and child health. As you normally like to say, Dr. Marianne, it's not all doom, it's not all hopeless. We know that a lot of things are happening globally and particularly in Africa. Maybe you could share some of the innovative approaches, the use of technologies, drones, whatever it could be out there that different stakeholders are embarking on to try and improve maternal and child health outcomes.
Well, yes, I'm the optimistic person, and I'm quite excited about that question because it opens the door of possibilities. What can we do? And one of the most innovative ways I've seen, and it's actually worked, is this program we call the Beyond Zero campaign. This was started in 2013 by our then First Lady in Kenya, Margaret Kenyatta, and she came up with this policy in that no mother should die giving birth. Beyond zero. And what did she do? She had this vision of having mobile clinics, Gigi. So what was this? So having a clinic set up in either on a truck, and this clinic can then be driven to the most remote parts of Kenya. And this clinic is well stocked with a doctor and nurse, all the equipment that this woman would need, medication, vaccines, and then driven to this woman, so meeting her at her point of need. So how did she raise funds? She started running, and she started having marathons and campaigns. And I remember I participated in that Beyond Zero marathon in Nairobi to raise money for these clinics. And as we speak right now, we have these clinics in many parts of our country, in many counties. Of course, there were a few drawbacks, but the initiative was amazing. And Margaret Kenyatta even won the UN Person of the Year award because of this very simple and very life-changing innovation. So having those mobile clinics is a very good innovation. Another good innovation for me, and it's also a topic of interest, is having well-educated community health workers. We need, if this woman or this baby cannot reach the clinic, can I reach her as a community health worker? I'm well trained, well versed. I can listen to the movement of the baby. I can do a bit of physical checkup. Is she eating okay? Is she taking her folic acid, for example? Does she know she needs folic acid? If she can't afford, does she know that green vegetables can also she can use that to supplement that? So having empowered community health workers also reach these remote areas that know how to really look after antenatal care and also provide some of those services is key in reducing the mortality and morbidity rates that we are seeing currently. There are many others, but yeah.
Of course. And maybe you want to come in,
Yes,
Reverend?
as a faith leader, one of the things I've known lately is that some churches have adopted this ministry to pregnant women, where especially in churches where they have nurses and midwives and those things, and you have pregnant women all around you. You don't go to your post, your station, and expect that your own church member that is pregnant, 2 or 3 or 4 of them, will come there before you interact with them. You seize on the opportunity, create a ministry within the church, and then within the community. The church is there to help the community. In fact, a church that is not relevant to the community is another thing altogether. So by so doing, they are, in a small way, they are able to minister to some of these people, and it really works.
Absolutely, really powerful. Yep.
Yeah, I was just going to add before it disappears in my mind, is another innovation I think which is really cool is telemedicine, where now we can use technology. Nothing stops us to have services at the tip of my phone, because as you know, most of us now have phones. Even in the remote areas in Kenya, they've done a study and they've shown that we have access to mobile phones. And I'm now seeing new innovations where they have like an SMS kind of service. Click number 1 if you need this, click 2 if you need this. And then now it also offers you some solutions. Are you feeling like this? Click 1. And that way then we can then reach the most vulnerable.
It's very interesting that you're saying that. You literally just end my thoughts. I was about to say, you know, one of the simplest things is it's about public education, which is what we literally always talk about in every episode of Africa Health Check. Raising awareness, public education, sensitizing the community. And the simplest way is really using our mobile service providers. I mean, we receive all of these promo messages, flash messaging, and group messages about the weather, about ringtones, about bundles and whatnot. So why can't we see our mobile service providers also partnering with clinics, the health sector, to send out flash messages about maternal health, child care, you know, information, even if it's not interactive, just those educational messages. I think that's one of the things that we really need to advocate for very, very strongly. Now, before we wrap up the show, I wanted to say that maternal and child health are among the key priority areas for achieving universal health coverage by 2030. And I know there's so many areas we need to prioritize in order to realize those targets. But if we were to just pick one aspect where we are greatly lagging behind, but a component that could also be a huge push factor to accelerating reducing maternal and child mortality in Africa, what would you say? What is that one immediate action or priority area we need to focus on?
Well, I'm very passionate about vaccines, and vaccines have saved lives. And there's this big publication that has come out saying that for the first time, we are seeing less deaths of children under 5. And do you know why? Because of vaccinations. The streptococcal vaccine, the Haemophilus vaccine, the meningitis vaccines that are given to children, to babies under 5, have saved their lives. So I would like us to invest more on vaccines. And me being a cool scientist, I'd like vaccines that are baby friendly. Because again, it's quite distressful to see that baby cry in the needle. And I know now there's innovations where we can have nasal vaccines.
Yes, you once talked about that. I think it was in last year's. Is it the last season? Yes. You're talking about was
COVID-19 vaccine that you just spray. Exactly. Yes. So just taking it a notch higher, or challenging anyone who's thinking of a better vaccine.
Yes.
I would really like to see that.
To make them child friendly. I think you're absolutely correct, because there are actually parents who withhold from taking their children to the clinics because they're just afraid of that trauma and the pain they're inflicting on their babies. So I think innovators, if you're listening, that's a challenge to you. And then Reverend, what do you think for you? It's that one priority or focus area.
I think government will need to strengthen the healthcare system, facilities, especially not in the cities and the urban centers, but in the hard-to-reach remote areas where it's difficult to have a pregnant woman transport herself to so far a place, to access these things we're talking about. This feature, the feature story, is one of a kind, and I see the motivation of this young man or this man, to be that I felt it in my own family, and I took a decision that this shouldn't happen to any other woman. My grandmother, who gave birth to my mother, died when she was giving birth to my auntie, and it struck me. Now I'm a nurse. How can I prevent this in any other woman? So he goes on a bicycle and then on boat, cross the Volta Basin, Volta River, to the pockets of islands and reach out to these people. So I think it is the same thought, which is being one another's keeper, being there for one another. And I think I like the motivation that not in my generation, not in my time. So then it is not what he will get out of it. It is what he's willing to give to society. To me, we should have this kind of things going on.
Yeah, being the change that he wants to see. Before we close, I also want to touch on this matter because we're emphasizing leaving no one behind and ensuring that even access to healthcare is inclusive. So I want to also ask you, Dr. Marian, if you could also touch on ensuring that interventions around maternal and child care are inclusive, because I know usually we leave behind mothers living with disabilities, children living with disabilities who experience even more unique challenges or barriers with accessing health care.
Yes, so actually it should be quite inclusive, and to do this inclusivity I believe starts with training the healthcare provider. Do they know how to look after this particular disabled person, or this person who can't articulate or mentally challenged? There are so many disabilities that sometimes you can't even see. So have we equipped this healthcare provider to be able to meet this mother, this child at their point of need? And that starts with creating awareness, starts with educating our healthcare providers, educating our community workers, and then identifying where these vulnerable people or these vulnerable women within a setting, within a village. And then with these community health workers, can they maybe meet this lady at her home and see where she needs help, maybe organize transport for her if she cannot walk, and if she can walk, there are ways to make her life more better so that she can have a more healthier outcome. So for me, I'd like our healthcare providers more strengthened to be able to meet our populations at their point of need.
Absolutely powerful. Very, very briefly, Reverend Achampong, there's an individual listening to the show right now at home and they're thinking, we're talking about healthcare workers, the system, governance, government, parastatals, private sector. What can I do? Because I'm also concerned about the high prevalence of maternal and child mortality in my region. What can you say to them?
I think it's one of encouragement, especially to this particular block, young teenage girls that become pregnant, and very poor people, jobless, have no one to care for them, becoming pregnant. Already there is so much stress on their minds as to how to care for themselves, and then this. I think there should be good Samaritans around, to be able to support these people, give them hope, and some relief to go through the full time, have their babies, and enjoy life.
Absolutely. And again, knowledge is power. So spreading that information, spreading that knowledge. If you've heard something, learned something from today's episode, you definitely can share it with a mother who might use it to save her child's life. So let's make sure we really join hands. I think this is one of those collective African efforts where each of us have a role to play, and only until we all play our roles can we actually achieve lowering maternal and child mortality. I definitely would love to live in an Africa where a mother does not die while giving life, and where a child has an opportunity to not only survive but to also thrive and realize their full potential. Before we wrap up today's show, I want to turn our attention to Mamelo Makelo from Lesotho, who is our African health champion for this episode. Let's have a look.
Mamelo Makelo is a true champion of healthcare in Lesotho. Her determination and compassion to improve the healthcare of women in rural Lesotho has transformed countless lives. As a registered nurse and midwife, her commitment to improving healthcare in rural communities is awe-inspiring. Despite the high maternal mortality rate and early forced marriages in her region, she saw these challenges as opportunities for change, empowering young women to take control of their health and futures. She strives for a world where women can make choices about their bodies and futures without obstacles. During the pandemic, Mamelo faced new challenges as health facilities closed and family planning services became inaccessible for women in remote areas. Undeterred, she embarked on an ambitious journey into the mountains, ensuring that healthcare and contraceptives reached those who needed them most. Mamelo Makelo is a true Africa health champion.
Really inspiring work from our comrade in Lesotho. Do keep up the great work. And that brings us to the end of today's episode. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories that we highlight right here. Follow us on Facebook, Twitter, YouTube, LinkedIn, and Instagram. The handle is @AfricaHealthCheck. Until we meet again, same time, same place, same date, remember the future is Africa, the future is today.